Good evening, everyone. My name is Dr. Zubair. Today, we are going to discuss about the hypersensitivity reactions and diseases caused by these reactions. We know that our own body immune system attracts to all the antigens that tries to enter in our body, or all the allergic substances against them. Our body immune response have some reactions, or our body immune system respond with various reactions. We include them in the hypersensitivity reactions, and diseases caused because of those reactions, we call them the hypersensitivity diseases or hypersensitivity immunologically mediated tissue injury or diseases. So let's start it. As immune responses, they are normally protective, but they are also capable of causing tissue injury. In injurious immune reactions, which are causing injury to the tissue, they are grouped under hypersensitivity, and the resulting diseases, we call them the hypersensitivity diseases. There is a long list of hypersensitivity diseases. We are going to discuss it one by one. There are many causes of hypersensitivity reactions, including autoimmunity, reactions against the microbes or microorganisms, and environmental antigens. Let's discuss the first one. As reaction, it is the autoimmunity, it is the reactions against self-antigens or our own body cells. Normally, the immune system, it does not react against the our own antigens or one's own body cells. This phenomena is called self-tolerance, implying, or what is the meaning of self-tolerance? It means that body is able to tolerate or it recognize its own self. So immune system does not have any reactions against our own body cells. Sometimes because of some diseases where the immune system fails or our immunity, it gets low, this self-tolerance fails. What will happen then? In this case, uh, reactions will occur against our own cells and tissue, and collectively we include all those reactions in the autoimmunity, and diseases which are caused by the autoimmunity, they are referred to as autoimmune diseases. Reactions against microbes or microorganisms. There are many types of reactions against microbial organisms or antigens that are causing the diseases. In some cases, the reactions appears to be excessive or the microbial antigen is unusually persistent. If antibodies are produced against such antigen, the antibody will bind to the microbial antigen, and this is how they will form the immune complexes, which later on will deposit in tissue and it will trigger the inflammation. This is how it will cause the injury to the tissue in which there is the deposition of the immune complexes. This is also the mechanism of the post-streptococcal glomerulonephritis that is occurring after the streptococcal infection. T-cell responses against persistent microbes may give rise to severe inflammation, sometimes with the formation of the granulomas. Another mechanism of tissue injury. Reactions against environmental antigens. Almost 20% of the general public is allergic to common environmental substances such as pollens, dust, mites, and latex, some other chemicals, some other substances that are included in the environmental antigens. Reactions. Classification of hypersensitivity reactions. They are divided into 4 types based on the principal immune mechanism responsible for injury. 3 are variations on antibody-mediated injury, and 4th one is related to T-cell mediated injury. First one, immediate or type 1 hypersensitivity reaction. Normally, it is also called the allergy. It is caused by helper T2 cells and Ig antibody and mast cells and other leukocytes. In this case, what is happening? Mast cells will release the mediators or chemicals. They will act on the blood vessels and smooth muscles, as well as the cytokines that will cause the activation of other inflammatory cells, and this is how they are causing the tissue injury. Let's discuss it again. It is a tissue reaction that occurs rapidly within the minute after the interaction of antigen with IgE that is actually bound to the surface of the mast cells. After that, what will happen? that mast cells, there will be the degranulation of the mast cells, and mediators released from the mast cells will cause the reaction, which we call the immediate hypersensitivity reaction. Now let's discuss the events in immediate hypersensitivity reaction. Activation of helper 2 cells and production of the IgE antibody, it will be the first step after the antigen exposure. This is the first time exposure. Immediate hypersensitivity, it is the prototypically helper T cell 2 mediated reaction. The helper T cells 2 that are induced by the antigenic exposure, it will cause, there will be induction of several, the induction of the helper T cells 2 by the antigenic exposure, it will cause the secretion of several cytokines, including interleukin 4, 5, and 13. They are responsible for essentially all the reactions occurring in this reaction. Now let's discuss few of it. Like interleukin 4, it will cause the stimulation of the B cells specific for the allergen to undergo heavy chain class switching to IgE, means the production of IgE antibody. Interleukin 5, it will cause the eosinophilic activation. There will be recruitation of these eosinophils at the site of reaction. And interleukin 13, it will act on epithelial cells and it will cause the mucus secretion. The helper T cells too, they are often recruited at the site of allergic reaction in response to chemokines that are produced locally. Now, one of those chemokine that is produced locally, we call it the eotoxin. It is causing the recruitation of eosinophil at the inflammatory site or at the site where there is the allergic reaction. First thing was the production of the IgE antibody. Now what is happening again? In the next step, there will be the sensitization of the mast cells by IgE antibody. Now how that is occurring? Mast cells, let's discuss about them. They are derived from precursors in the bone marrow and widely distributed in tissues residing near the blood vessels and nerves, and also in the subepithelial locations. They have a higher affinity receptors for constant portion of the IgE antibody. Then what is happening in this case, like the serum concentration of IgE, as you know that it is very low in the range of 1 to 100 microgram per ml. But the affinity of mast cells receptor is so high that receptors are always occupied by the IgE antibody. This antibody bearing mast cells, they are sensitized to react if the specific antigen, the allergen which was exposed before, if it binds to the antibody molecule again, this will cause the sensitization of the mast cells. Basophils, they are also circulating cells that resembling the mast cells. They also express the same receptor the mast cells have for IgE, but their role in immediate reaction, it is not established. Since these reactions occur in tissue and most basophils are in the circulation, this is one of the reason. The third cell type that expresses the same receptor like the mast cells, FCER1, it is the eosinophil, which often are present in these reactions. Thirdly, what is going to happen? Activation of the mast cells and release of the mediators. Now, this is the main cause of the immediate hypersensitivity reaction, or the symptoms which are occurring in this case. When a person who was sensitized by exposure to an allergen, if a person is re-exposed to that allergen, the specific antigen to which he has already been exposed, this allergen will bind to antigen specific IgE molecules on mast cells, usually at or near the site of allergen entry. Cross-linking of those IgE molecules, it will cause the series of biochemical signals that will cause the secretion of various mediators from the mast cells, or it will cause the degranulation of the mast cells. Now, what is going to happen? There will be the different three groups of mediators that are important in different immediate hypersensitivity reactions. They are released from the mast cells. Also, the vasoactive amines, they are released from the granules stores. The granules of the mast cells, it contain the histamine. It is released within seconds or minutes of activation. And what is the histamine causing? It is causing the vasodilation, increasing the vascular permeability, and causing the smooth muscles contraction and increased mucus secretions. Other rapidly release mediators, it includes the chemotactic factors for neutrophils and eosinophils, as well as neutral proteases, for example, tryptase, which will damage the tissue, and it will also generate the kinase and cleave complement components to produce additional chemotactic and inflammatory factor. This is how it is. This is the linkage between this and inflammation. The other group of mediators released, it will be the newly sensitized lipid mediators. The mast cell synthesize and secretes prostaglandins and leukotrienes. Prostaglandin D2 is the one, or D2 is the most abundant mediator generated by the cyclooxygenase pathway. In the mast cells, it is being produced. It is causing the intense bronchospasm as well as the increased mucus secretion. The leukotrienes, leukotriene C4 and leukotriene T4 are the most potent vasoactive and spasmogenic agents. So right now we are going to discuss about the clinical and pathologic manifestation. The IgE triggered reaction, it has two well-defined phases. The first one will be the immediate response and second one will be the late phase reaction. The first one, it is stimulated by the mast cells granule contents and lipid mediator. And right now we have discussed like histamine, prostaglandin and leukotriene. What are they causing? They are causing the vasodilation, vascular leakage, and smooth muscular spasms. It is evident usually within 5 to 30 minutes after exposure to an allergen, and it will finish by an hour. Second phase, it is stimulated mainly by cytokines, and it sets in 2 to 8 hours later and may last for several days. It is characterized by inflammation as well as the tissue destruction, such as the mucosal epithelial cell damage. The dominant inflammatory cells in this reaction, late phase reaction, it includes the neutrophil, eosinophils, and lymphocytes, especially the Th2 cells or helper T lymphocytes. Clinical manifestation. An immediate hypersensitivity reaction may occur as a systemic disorder or as a local reaction. The route of antigen exposure after often determines the nature of the reaction, how like what kind of reaction is going to occur, either local one or the systemic one. Systemic exposure to protein antigens, for example, occurring in the bee venom or after a bee sting, or drugs, example penicillin, it may result in the systemic anaphylaxis. Within minutes of exposure in a sensitized host, there will be the itching, urticaria, hives development, and skin erythema or redness will appear, followed in short order by profound respiratory difficulty because of the pulmonary bronchoconstriction as well as the hypersecretion of the mucus. The laryngeal edema, it can be so much that it may exacerbate matters. Its exacerbation can cause the upper airway obstruction. In addition, the entire gastrointestinal tract musculature may be affected. It will result in the vomiting, abdominal cramps, and diarrhea. Systemic vasodilation, it will lead to the fall in the blood pressure, and we call this the anaphylactic shock. It may lead to circulatory collapse and death. Local reactions, they are occurring when antigen is confined to a particular site, such as the skin following contact. For example, occurring in the after applying some kind of cream or some moisturizer, and if a person is allergic, there can be the local allergic reaction. The gastrointestinal tract, it can occur following ingestion or after inhalation occurring in the lungs. And atopic dermatitis, food allergens, hay fever, certain form of asthma, they are examples of the localized allergic reaction. So we have discussed that the type 1 hypersensitivity reaction, it is mainly mediated by the mast cells degranulation and cytokines. And there can be two forms of the clinical manifestation. There will be the first one we call it the early phase one, and second one will be the late phase reaction. In early phase reaction, that is actually subsiding after an hour, and the late phase reaction, it will occur after hours and it may subside after days. And late phase reaction, it is mainly by the cytokines, and local one is by the degranulation of the muscles mediators. Now, what were those mediators? It included histamine, leukotrienes, and the prostaglandins and leukotrienes and histamines. Their reactions, we include them in the type 1 hypersensitivity reactions. The type 2 hypersensitivity reaction, which actually is the antibody mediated also, it is the antibody mediated hypersensitivity disorder. It is caused by antibodies directed against the target antigens, which are on the surface of cells or other tissue components. What is the mechanism? Antibody causes diseases by targeting cells for phagocytosis, or activating the complement system, or interfering with the normal cellular function. Opsonization and phagocytosis. The first mechanism of the antibody-mediated injury in type 2 hypersensitivity reaction. The circulating cells, for example, red blood cells or platelets, they are coated, opsonized with autoantibodies, with or without complement proteins. The cell will become, after that, as they are opsonized, they will become target for phagocytosis by neutrophils and macrophages. The antibody-mediated cell destruction and phagocytosis, it is occurring in following clinical situation. For example, transfusion reaction, hemolytic disease of newborn, autoimmune hemolytic anemia, and certain drug reactions. The second mechanism is the inflammation. Antibodies bound to cellular or tissue antigen, it will activate the complement system by the classical pathway. Classical pathway is activated by the antigen-antibody complex. And antibody-mediated inflammation, it is responsible for tissue injury in some form of the glomerulonephritis, also in the vascular rejection, in organ grafts, and some other disorders. In some cases, when antibodies are directed against the host protein, it will impair or dysregulate important functions without directly causing cell injury or inflammation. For example, we are in myasthenia gravis and in Graves' disease. In myasthenia gravis, the antibodies, they are directed against acetylcholine receptor in the motor end plates of skeletal muscle, and it will cause the inhibition of the neuromuscular transmission. This will result in the muscular weakness. In Graves' disease, the antibodies, they are directed against the thyroid stimulating hormone receptor on the thyroid gland. It will stimulate the thyroid epithelial cells to secrete more thyroid hormone, resulting in the hyperthyroidism. This was the type 2 hypersensitivity reaction, which was also the antibody mediated one. And in this case, antibody the mechanism of injury or antibody mediated diseases. In this, we have discussed that the antibodies, they are causing the diseases by targeting cells by either phagocytosis or by activating the complement system or interfering the normal cellular function. And then we have discussed that how opsonization is occurring, and the diseases in which are the reactions or clinical situations in which the opsonization and phagocytosis is occurring. And then the second mechanism was the inflammation, which was the inflammation which was activated by the complement system by classical pathway, which is activated by the antigen antibody complexes. And it is occurring in glomerulonephritis and vascular rejection, organ grafts, and some other disorders. And antibody mediated cellular discussion, we have discussed myasthenia gravis and Graves' disease.